While many may consider colon cancer a disease that affects an older population, Dr. Avinash Bhakta, an assistant professor of surgery at the University of Kentucky Markey Cancer Center, says that's not really the case.
Unfortunately, there's a rise among colon cancer and rectal cancer in younger populations. It can be even in our teenage years. I've had several patients since coming to Markey Cancer Center in their teenage years being diagnosed with colon cancer.
And that's why it's important to know the signs so a person can get tested as early as possible. Dr. Bhakta says they include unintentional weight loss, blood found in stool, and changes in bowel movements. He also says people with an average risk should start getting screened at age 45. But those who are at a higher risk, like if there's a family history of colon cancer or inflammatory bowel disease, should get screened sooner.
Screening is probably the most important tool to help save lives because it can catch polyps before they become malignant, and it can also treat earlier cancers as well.
Specifically in Kentucky, the center is focusing its screening efforts on certain populations, like those in eastern Kentucky.
Within our Commonwealth, there's a high risk of hereditary cancers, especially in our eastern Kentucky Appalachian population, where there's a high incidence of Lynch syndrome, which usually causes colon cancer at earlier ages than the 45.
And the center is looking into what barriers affect these and other communities, like Black populations, that also put them at a higher risk for colon cancer. And with some people hesitant to visit their doctor during this time, Dr. Bhakta wants to make sure people understand that screenings save lives.
We don't want this pandemic to kind of take away all the work that has been done in our Commonwealth to improve our screening rates from 49th in the nation to 16th in the nation.
If getting a colonoscopy leaves you hesitant to get screened, there are other less invasive screening options to start with. In Lexington, Alex Valverde, LEX 18 News.